Few weeks ago, Borno State was hit hard by a devastating flood that displaced countless of lives and disrupted communities. As residents begin efforts to rebuild, several organizations and individuals, including the United Nations, have stepped in to support those affected. Along with the structural damage, the flood has raised serious health concerns, including the potential outbreak of waterborne diseases like cholera and malaria, along with respiratory infections and mental health challenges. Today, Premium Times is on the streets of Abuja to gather people's thoughts on this critical assistance.
More especially people that were displaced. They were put in one place. We discovered that 5 people were living in IDP. 5,000. It is too bad for 5,000 to live in a particular area, particular environment. What if it happens that once it's contacted by disease, it's going to affect the others?
So based on what we heard, say the flood affected even graveyards. Corpses were buried, decomposing corpses probably, and animals probably that have died, everything washed. All these things can cause diseases. Cholera and what have you can spread from such, and keeping people in a very close enclosure without adequate hygiene provision can cause diseases, of course.
Waterborne diseases, of course, it is bound to even become more prone in that area. Imagine soccerways, imagine so many other dead like cemeteries, mortuaries. The dead bodies will wash away and it will contaminate even the already contaminated water. So the waterborne diseases, you expected it to even get much spread.
You know, the water in which they were in, very dirty water, we know what that can result into. You can imagine a stagnant water. You know, back then in our primary schools and secondary school, they will tell you stagnant water can bring a lot of diseases, right? So you can imagine what stagnant water or even a very dirty water, as much as that would be able to do to someone.
You are talking about the burial ground being washed away. We know whatever is on the ground. These people, they are dead. Now to have their particles and whatever on the water that these people drink or bathed, it will seriously affect them.
Irrespective of where they are held at the moment, there should be adequate provision for hygiene.
Right now, I'm expecting the authority concerns to take a protracted measure to make sure that these people have been put in a proper place, that they will be enjoying their self for what has happened.
A polluted environment. The environment is now highly polluted. That, if not well handled, will lead to, and of course, this is the time when it's not something you just sweep under the carpet.
The issue with the Borno flood is a very saddening one, because it's more than just a case of physical devastation. It's a systematic failure, right? It's a systemic failure because the issue of flooding in Borno and other states across Nigeria has become recurrent, right? So it begs the question of why we haven't put the measures in place that we need to put to reduce the impact of this or reduce the level of recurrence. Of course, with flooding, you have the potential for waterborne diseases, right? So when floods like this break out, the cases that issues like cholera or just waterborne diseases would naturally increase. So it's a health disaster that's also looming as well. And of course, when people are displaced, we have a lot of people living in very unsafe conditions, very conditions that are not livable, that are substandard, right? It increases the health risk. So what can we do exactly? Is that and that's where relief comes in, right? And I know that there are a lot of non-governmental organizations that are, rising up to the challenge, ensuring that they are providing health-related aids, to ensure that they are treating the sick, they are, helping to get clean water across, to these people. So what we can do at the moment is just to push forth health relief to ensure that we're putting medicines there, we're sending medics, we're sending all the support that they need to avert further health crisis, but to stop this from happening again, we have to fix the systemic issues. We have to ensure that we reduce the chances that this happens again.
The recent Maiduguri flooding, just like any other topical issue, would always attract disinformation and misinformation in our environment. Over the past few days and weeks, we've seen pictures and videos used out of context to portray the flooding. We've seen different varying statistics of people it has affected, and people are confused how large is the impact of this. One of the videos we have seen is videos from the Japan landslide being used to portray the Maiduguri flooding. We've also seen pictures of dead bodies being used from Yobe State's terrorist attack being used to portray the flooding. And the varying statistics can also be confusing. The issue with this kind of disinformation is that it raises fear. For example, the pictures of dead bodies, it causes people, it will bring fear and panic into the minds of people. It will make the issue look bigger than it actually is. And it also creates distrust in the media. For example, the varying statistics we are getting from different institutions and bodies who are supposed to be the authority. Now people are wondering, who do we believe? How many people were actually affected by this flood? So that is also an issue that disinformation poses for people.
From the voices we've heard today, it's clear that the UN's support is a welcome relief to many. However, the road to recovery is long, and much still needs to be done to restore health services and ensure the well-being of flood victims in Borno State.